SickKids Hospital is dealing with extremely high patient volumes and is warning people of long wait times if you're showing up. CP24's Christina Tenalia is live with more on this story. Lots of warnings and a bit of an explanation coming here, Christina.
Yeah, let's get right to it. Dr. Jason Fischer joins us now. He is the head of emergency medicine at SickKids Hospital. Dr. Fischer, thank you so much for joining us because, of course, there's quite a bit of concern here. And my first question to you is, so according to the SickKids Twitter account, there are longer than normal wait times in your emergency department for non-emergent issues because you see the sickest patients first. So why are people then coming to the emergency room for really non-emergent issues?
Well, Christina, I think we're seeing really two things happening. The first is that, of course, we're in viral season. And so we're seeing lots of viruses circulating. Kids are getting coughs, colds, and fevers. But the second issue is that there's just a lack of access to care. We're hearing from families that they're having trouble accessing their primary care, their family doctor, their pediatrician. Their local urgent cares are busy, their local emergency departments are busy. And so they're coming to us at SickKids. And this means that our wait times, which of course are not proportional to the number of extra patients coming, because the emergency department relies on other services like diagnostic imaging and labs and consultants, these times grow disproportionately, and they're leaving a lot of patients wondering, why am I waiting so long?
And we've reported, and you know, Dr. Fischer, about the shortage of family doctors here in the province, and that is often the first point of care and line of communication for many families. My own family doctor retired this summer after 30 years. So it's a challenge for many parents and families. What do you suggest that they do?
Well, I think the first thing is we want to make sure that children are being vaccinated so they reduce that burden of illness. So make sure you're getting your COVID vaccine and your flu vaccine. The second thing is to connect with your doctor's office. Really make sure that they're not seeing patients. Make sure you know when their hours of operation are and what to do if your child does get sick. The next thing is to use the resources that are available online, like About Kids Health, that's available on our SickKids website, and also our SickKids virtual urgent care platform that allows parents, caregivers, patients to go online and to check and see if their symptoms require an emergency visit or if they can wait until the symptoms subside.
Dr. Fischer, that's a great resource. Thank you for reminding our viewers about that. When you talk about longer than normal wait times for non-emergent issues at your emergency room, how long are you talking about?
Well, as everyone knows, patients don't all arrive nicely spaced out throughout the course of the day. And if we have a large volume of patients arrive in the late evening, wait times can be 3 to 4 times what we would normally expect. And we have had wait times as long as 12 hours.
Okay. Yeah, so it gives parents some perspective. Dr. Fischer, thank you so much. You've given us, our viewers as well, and parents some ideas and resources. And certainly we know it's challenging for parents sometimes to get in touch with their primary care provider. But obviously, as you noted, there's a resource through SickKids where parents can determine if their child's case is indeed an emergency and if they should come here to SickKids. Dr. Jason Fischer, we appreciate your time. Thank you so much.
Thank you.
Okay, so really the message here today, this really was predicted and anticipated. It is a flu season. Of course, the concern is that there's going to be an uptick in COVID-19 cases this autumn and winter as people make their way indoors. The message from the doctor, he's asking parents to have their children vaccinated. Aside from that, despite what your child's case may be, try your best to get in touch with your primary care provider. If you need further assistance, of course, SickKids is always here. But for non-emergent cases, as he said, at times it could be a 12-hour wait. Back to you.
Yeah, great interview, great context there. Okay, Christina Tenalia live outside SickKids today.